This is NBC 10 at Issue.
The Philadelphia-based nonprofit MANA has been serving nutritious meals to millions of people in our region with life-threatening illnesses. Lately, MANA's food is medicine approach has garnered the attention of insurance companies interested in helping their clients stay out of the emergency room. As a member of MANA's board of directors, I got a chance to find out firsthand how a prescription for your diet works. It takes careful coordination preparing these meals. Making sure the portions are appropriate is only part of this equation. The hand-picked ingredients are just as important.
I was diagnosed in '91.
Diabetes has been a daily struggle for Tanya Farmer of North Philadelphia, but the mother and grandmother tells me her diet has improved since receiving these MANA meals.
Before the MANA program was pretty hard. My major weakness was portion size.
MANA is the only organization in the country that has a complete meal program that's delivered to the homes of the clients completely free of charge to help them win their fight against their disease.
Sue Dougherty, who is a licensed dietitian and nutritionist, is the CEO of MANA, a nonprofit that serves the Philadelphia region.
MANA is in its 26th year as an organization, and we are all about food as medicine, and we've really been fighting and advocating to get food as medicine recognized through insurance companies for many, many years.
I've been asked by people why we're doing this. To me, it's sort of like a no-brainer.
Bill George is the president of Health Partners Plans, or HPP, a health insurance company with members in the Delaware Valley. Earlier this year, he decided to give the food as medicine model a try. A pilot program was born with MANA providing education and meals 3 times a day for about 12 weeks to diabetics. Diabetics like Tanya Farmer, who are members of HPP's Medicaid plan. Joining me now is Sue Dougherty, the CEO of MANA, who's also a registered licensed dietitian. Sue, thanks for being with us.
Oh, thanks for having me.
Okay, so we've seen how the pilot program works. What are the results? What kind of impact is this having?
So this is having a huge impact on the clients that we're serving. Today, we're about 1.5 years into the relationship with Health Partners Plans, and we've served several hundred of their clients, and they're seeing decreases in hemoglobin A1C, decreases in overall medical expenditure, and really keeping people out of the hospital, which is what this is all about. And we're thrilled that since we signed on with Health Partners Plans, we've also signed a contract with Keystone First, which we're just about to start and serving their patient population as well.
Same kind of thing, a pilot program. Is it diabetics or other?
They're not actually going to be disease specific. They're really looking at their sickest of sick and who would be most impacted by the meal program.
And that's sort of what I wanted to touch on. With this pilot program with HPP, it's obviously serving people specifically with diabetes, but MANA, generally speaking, serves people with all kinds of life-threatening illnesses.
Yeah, last year we touched over 85 different illnesses that we served, and actually with HPP we're serving people other than diabetes as well, people with cancer also.
Got it. I would imagine that other organizations are taking a look at the success of this pilot program. I mean, you just mentioned Keystone First, and are interested in mimicking the same kind of success and the same kind of partnership that you've been having.
Sure, and certainly our goal that this will exist nationally someday. I mean, we're really focused on getting this statewide now, and that it just makes sense. You know, we've all been there when we've been told for the first time that you have this life-threatening illness, and you get a prescription for a diet, and we see ourselves as that pharmacy, and we want that there to be pharmacies across the country. So there is more and more interest from insurance companies on a national level to make sure that this service can be provided everywhere.
I mean, it's not just that when you are sick and seriously sick, you need help with making meals for yourself, for your family, but also getting the right meals.
Absolutely. As a registered dietitian, I know firsthand, I studied food science for 6 years. It is complicated, and for people to have to deal with that and learn all that, and I think that's a key component that we don't talk about enough at MANA, is it's not just the meals, but it's the education that goes with that. Our registered dietitians are on staff to make sure that they're working with the clients while they're on the program, so they can get educated so that when they come off the program, they can sustain that diet and hopefully sustain their health.
And we should be clear, and we sort of saw it in that video, that when the meals are being made, they are actually specific to an illness.
So we have 11 different diet modifications, and unfortunately, most of our clients are battling more than one illness. So a lot of our clients may be on a different combination of a up to 3 different diets.
We're seeing video of the volunteers at work in the kitchen. How much do you rely on the volunteers to do this work?
They're the life of the organization. We're a small staff. We're about 36, but we're a volunteer force of about 150 volunteers. And we're going to be moving. So we're going to be moving. We're going to be able to grow from doing 1 million meals a year to growing to 2.5 million meals a year. And we are going to have a much increased need for volunteers.
What's the next step in developing this program, and how do you balance it with continuing to serve Manna's other clients?
Sure. So the whole goal of reaching out to the insurance industry is that we can serve more clients that insurance isn't covering. So as we advocate and fight on national front to get this recognized, there are many clients that insurance is not covering this. So for every client that comes on, we want to make sure that we're taking on 2 clients that insurance isn't covering. So really the expansion and really trying to eliminate our waiting list. Today we have a waiting list of about 4 weeks, and we want to, when we move into our new facility, to be able to eliminate that waiting list and make sure that people here in the service region are getting the medically appropriate meals that they need.
And people who are either involved in one of these pilot programs with the insurance companies or people who are directly in contact with Manna, this is not meant to be an indefinite kind of relationship.
No, the average length of stay is about 9 months. So when clients come on to service, they come on for an average of 6 months. And then with our team of dietitians and with our healthcare providers, they're reevaluated. And if they need to be extended, we extend them. And we just keep in track with them on a monthly basis.
And they're getting counseling too. So it's not just that they're getting the meals and learning that way, but they're actually getting counseling.
I think probably one of our most popular things are the cooking classes.
Sure.
So we bring our clients in, we'll do cooking classes with their dietitians and with our chef and make sure that they get the education they need.
How do these pilot programs working with the insurance companies and really sending that message of food is medicine home, how does that tie into the evolution of Manna? I mean, Manna's been around for about a quarter of a century.
We are celebrating our 26th year, and so really we've been kind of like screaming from the rooftops forever that food is medicine is critical and important. And I think our research that you guys have talked about in the past that was published in 2013 that shows the cost savings is what has really gotten the attention of the insurance industry. And now that they're seeing the impact on, not only are their clients feeling better and they're saving the insurance industry lots of money, I think that this is really going to pick up momentum. And I think someday, hopefully, we'll be talking that, can you imagine that insurance wasn't paying for this? That will be in the near future, we hope.
All right, Sue Dougherty, the CEO of Manna, thanks so much for being with us. We appreciate it.
Thank you.